Welcome back to True Women's Health Facebook Live. We are embedding this extra video so that we could interview Sarah, who's been on our show before. First off, Sarah, I just want to say thank you for coming on our show and thank you for just putting out all your information to the rest of the world. I know it really resonates with a lot of women, both who are in the middle of this journey or maybe just curious, kind of that they even maybe have lipedema.
Yeah. Well, thank you for having me. I think it's really important to share if you're able to, and I'm really happy to do that.
Yeah. The first time you were on to talk with us, we were really talking about your diagnostic journey. Like, what's it like to be living with lipedema without a diagnosis? And then, we met for the first time so as a consult, and then hearing that you had that and sort of moving through. And now we're going to talk about sort of your journey on the other end of a lot of treatment options, the biggest being reduction surgery.
Mm-hmm.
So just so that everyone's sort of on the same page, reduction surgery is where a surgeon will use surgical tools to physically remove fat cells, scarring, skin at sometimes. The word that we throw around is liposuction, but I think it's a lot more than that. I mean, that is some of the tools that they use, but there's a lot more back and forth. And I think the word liposuction has a connotation of a certain type of surgery when this is so much more than that. When I think about treating a woman with lipedema, I'm thinking about how do I remove extra tissue so that her legs move a little easier? How do I decrease pain? And how do I decrease swelling? So, Sarah, why did you decide to go down the treatment pathway of reduction surgery?
Well, upon getting diagnosed with lipedema and learning sort of what the options were for treatment, I knew after years and years of not having any answers, knowing that there was a table full of solutions for me, the most aggressive being reduction surgery, I was really motivated to go that aggressive route, knowing that this was sort of my best chance at having the highest quality of life moving forward. A lot of the research that I'd read was really promising too, even though there's not a ton of it at this point. So it felt like the right decision. I was really just like following my intuition on that as well. And I just sort of, the stars aligned personally as well, because obviously a lot goes into making something like that possible. But I knew that I just wanted to give myself the best possible shot at moving forward.
Yeah. And I think one of the things that's really tough in the United States is that it's very hard to get insurance coverage for this, I would deem, a medical procedure.
Mm-hmm.
And still, even the out-of-pocket costs are really high, tens of thousands of dollars. There's not a tremendous amount of surgeons that do it in the country. So we're talking about traveling to different parts of the country. I know I have a lot of patients that travel to Atlanta, Chicago, the East Coast, West Coast. What was on your mind in terms of, like, because you made your way to Madrid, like what was on your mind in terms of how you got there?
Yeah, I mean, I kind of had to come to terms with the fact that having such a major surgery done abroad initially sounds insane.
Mm-hmm.
Figuring out how do I present this to my boyfriend, how do I present this to my family? So that way they, obviously they were very supportive, but I wanted to assure them like, hey, I am sure this is the right thing for me.
Yeah.
I need you to be supportive in my journey. So that was sort of like the foundation of that coming to life. But then there's just all the logistics you have to put together. Like for me personally, like figuring out where you're going to stay while you recover. Is that an Airbnb? Is it a hotel? Your flights? Just sort of figuring out any logistics of, was my passport up to date? Like really silly things like that.
Yeah.
But things that truly have to align for something like that to come to fruition.
Yeah. I'm laughing. I'm smiling because it reminds me that every woman with lipedema, like everything you do has to be just like this extra hard step. Right? Like even like the women that come see me, they're like, well, I drove 4 hours. I'm like, God, why is this just extra hard? These women with lipedema, for heaven's sakes. Like, I hope we continue to make this easier and easier to bring these barriers down. So I know it is just a haul to get all these little details in order. And that's on top of getting ready to have like a major surgery.
Yeah.
So I think one of the things that sometimes runs through women's heads is, or even family members, right, that are on this journey with our women patients, is that it's super easy, just going in real quick, right? Just take off a couple of liters of fat fluid and we're done. And I think it's really important to talk about that's not the case. I don't know if you don't mind just describing a little bit of the post-op surgery and after, the recovery period after you had surgery.
Sure. Well, I kind of have compared it in my brain. I've run a few races and have trained for some races in the past, and it felt like training for a really big race, because it wasn't like you could just show up and it was done and then you walked away with your medal and that was it. There was a lot of, like, just for instance, I had to wear flat knit compression 3 months leading up to my surgery date before I even, got to Spain. That process had already begun. And then in terms of post-op, like, obviously there's the immediate post-op where you're bruised and you're swollen and you got to take your antibiotics and do your blood thinner shots and go to your daily MLD. Like, there's a lot of immediate post-op things that I'm sure a lot of women probably have heard or would expect with a procedure like this. But then there's also a lot of the little things that, I flew home and now I'm having to just going up the stairs in my house for a few weeks when I had my lower surgery done, going step by step sideways to ensure that I kept my balance because my ankles didn't have full mobility yet. Just until recently, even though it's been, 8 months, being on my knees on the ground felt like almost there was like a floaty in between the floor and my body, So even though I don't have any of like the heavy lipedema symptoms in my lower legs anymore, like, that healing truly is a process, and you have to give yourself grace and you have to understand it is a marathon. It's not a sprint. And while you can get back to your life and you can enjoy the successes that you go along the way, you just have to really treat your body with the kindness and knowing that it's recovering from something really major. And, it's not easy, but it's worth it. I have no regrets.
And we're going to talk about the worth it part because I really think that that's important to highlight. Did you have 2, 3 surgeries? Kind of tell us a little bit about the steps that were taken. Because, one of the things that people don't realize is you cannot take away a lot of fat all at once. So our fat actually is a water storage unit for our body. So not only is it storing carbons, but it's a way of storing water and fluid, which is kind of a bizarre mechanism. But for instance, a camel's hump is actually made all of fat, and that's why it's able to go long periods of time without water, because it's storing water as fat. So when we surgically remove a lot of that fat, you cannot just remove endless amounts because your body really does respond. And it's like, what the heck, we lost all this fluid, and it can do a lot of things hemodynamically, meaning your blood pressure can drop, you can become anemic. So a lot of the times these surgeries do have to be done over stages for safety, because one would think you could just go in and, take away as much as you want at one time, which is not the case. So how was your surgery sort of staged out?
Yeah. So I've had 3 surgeries on my legs from, hips and flanks to my ankle. The first was lower legs, and that was in September of 2025. They removed 5.5 liters. I had indicated on the level of intensity, I said, go as intense as you can go. I'm fine with that. So that was, September 2025. And I could have gone back sooner, but I gave myself a little more time, not knowing what to expect. Between surgery 1 and 2. So I went back for surgery 2, which was my upper legs in the front from like my knees up to where my torso is. That was the end of January 2026. That was 6.4 liters removed from that area. And then my surgeon, their guideline was like 8 to 10 weeks was like the shortest amount of time that they would say, yes, you can come back for your next surgery, obviously pending that your blood work and everything looks healthy to do so.
Mm.
So, my blood work, I did have, like how you said, like I had some low iron. So after my first surgery, so I was on supplements. I'm still on them, just making sure that that stays at a healthy level. And then I went back one more time in end of March of this year. And that was 5.1 liters removed from the back of my upper legs. So top of the knee up through my hips and flank area. So 17.1 liters removed total.
Wow.
Some women I've talked to who have gone to the same surgical clinic have done their uppers surgery in one. It just really depends on your height, your weight, how progressed your lipedema is. Like they do it on a case-to-case basis. Mine getting split into two is pretty typical.
Yeah.
That is pretty typical, and I wouldn't have wanted it any differently.
Yeah. And, one thing I'll just mention, because I think it can be hard, there isn't like one surgical guidelines. Like, so for some things in medicine, like there's very clear protocols, chemotherapy, for instance, like if a woman is going through cancer, if you go to treatment in New York versus California, the treatment options a lot of the time are very much the same. For lipedema surgery, that's not the case. I think we're finding more and more as doctors are getting aggressive with reduction surgery, more and more surgeons are dedicating the majority of their time to reduction surgery, that we're finding patterns. I think this is a very common pattern where they'll take fluid from the front and then the back, and then or they'll break it up into upper, lower sections, and then they'll break the upper body up as well. So that is a very common way that we see it, but not the only way that it could be done.
Yes, absolutely. And even I've seen varying protocols for compression as well. Like afterwards, like my protocol has me in my flat knit custom compression for 3 months at minimum post-op, and some people's it's a little shorter. It just depends on the surgeon and their approach. And so I always like listen to your surgeon.
Yeah. I think, not interestingly, even women who are getting cosmetic surgery, like a mommy makeover, they're in compression too. So that is not an only lipedema thing. That is a common thing for any woman sort of going through these procedures where we're taking away fat tissue and skin. So a long haul, a ton of extra fluid removed. Tell us, like, how do you feel? What has been the biggest difference in your life?
I feel really great. The difference, even after just having my lowers done, I could tell going up the stairs in my house, once my swelling had gone down, I was like, wow, I feel like I'm flying up the stairs. And now having had the subsequent 2 surgeries on my upper legs as well, I really just feel like I can sit more comfortably. I no longer feel like my body's in my own way, if that makes sense. I can walk faster, like my pace, like without feeling like I'm really like trudging along. I don't feel the same pain from like pressure points. Granted, I still have some numbness and some tenderness that is obviously just in the healing process. So I kind of joke, I'm like, well, I can't really feel whatever anyway on the surface, but beneath, I can tell the difference is significant. Even sitting on the floor cross-legged, I used to get the tingles of like my legs falling asleep almost immediately. And now I have to remind myself to like change positions. Because I sit there and I'm like, I should probably stretch my legs out or else I'm gonna get pins and needles. Like I noticed that difference with like my circulation. And just also the mental aspect, the freeing mental aspect of it, not sort of dominating my daily thoughts. Obviously I'm still thinking about it because it's a really big part of my life and this journey I've been on, but it's no longer a hindrance in the way that it was before.
Our minds are pretty amazing. And we see this also in the obesity medicine world at times where, we'll give some of these drugs and women will talk about the food noise going away and how consuming that was for their time, their mind space. And I think for women with lipedema, sometimes I have to remind them, I'm like, you don't realize how much of your mind space is being dedicated to just managing these little things, managing the pain, managing the heaviness, like just doing all this problem solving behind your consciousness of like, well, how am I going to get up the stairs? And can I do that? But I have to go to work later. And like all these like weird mental games that now your brain is a bit free from.
Yeah, I remember in my first conversation with you during my appointment where I was diagnosed, having the realization that I had normalized quite a lot of my pain and my symptoms.
Yeah.
Because I hadn't known any different until then. So I think that's something that a lot of women with lipedema experience and would relate to.
And you know, a lot of lipedema comes on during puberty, like when you're a child growing up. So essentially your entire life. And like, how would you know that that was any different than what everyone else was experiencing? That was a lot of how you feel. What about like day to day? What have you noticed? Like, is there anything new that you're like, I've done this thing and I'm like, so I never thought I would do it. And here I am.
I mean, there's a lot of, there's just a lot of like feelings of being content because like, for example, like I remember I was on a work trip and we were in a shop and I saw a really cute skirt. And normally I'd be like, oh, I can't, like, I'd have to try it on. I'd have to do the whole thing. And I literally just grabbed it off the rack, guesstimated, and got home, tried it on, fit me. I was like, this is new. I've never really had that experience before. Specifically, like physically feeling my own body, feeling like my shin bone for the first time was strange, cool, but also like, wow, there's parts of my own anatomy that I'm becoming familiar with now that the lipedema had sort of hidden from me. And I'm not quite to the place yet where I feel like I could physically do this, but I'm really looking forward to the feeling of what it'll be like to run without lipedema weighing my body down. I've heard from some other women who are active and runners that they were like, you won't believe it, like what the difference feels like. So when I get there, I'm really looking forward to it because even just on my long walks, I can tell I can walk for longer. It feels lighter. I can move in ways that are just, I don't know. I'm still having those moments, those light bulb moments of realizing like, oh, this is different. Like I would not have been able to do this before, or this wouldn't have felt like this before. But it's nice because it feels like, oh, this is how it always should have been.
Yeah. And which again, I think content, I think that's a great word because I think for a long time, women with lipedema, contentment is very far away, right? I think that that's a great sort of visual to see and hear. So just to be completely unbiased, we're not trying to sell any reduction surgery. Was there anything you expected kind of in the negative way that you were like, oh man, this kind of stunk. That was not as great.
Yeah. I mean, I guess what I would say is I knew pursuing the surgical route would be hard. So I absolutely had days where, you know, I hit an obstacle, and maybe it was in terms of trying to get my vein scan for, you know, ahead of surgery that they need to rule out any varicose veins of importance. Maybe I hit an obstacle that day and I'm like, how can I possibly continue on? It's like, I'm at the very beginning and I'm already hitting a roadblock. And, you know, just really sort of having that, like, pick yourself up again the next day, try again. And I really kind of led with that mentality because I knew if I let the negative sort of swallow me, if I wallowed in it, it would be that much more difficult to continue ahead. So in preparing, there were days where you just had to maybe set it down and revisit it. Like that's kind of really all you can do sometimes.
Yeah.
I will say in terms of surgery and like being in Spain for recovery, everyone is different. Everyone's experience is different. I would say for me, I was not in any crazy pain. It was just, I'm uncomfortable. So there are moments where I'm like, all right, I am sitting here and this is uncomfortable and there's nothing I can do about it. I just have to live in it and let it happen because that's just what you have to do to heal. You know, I would only say there was just like one time. It was when I had my third surgery, which included my hips and flank area, where I had, you know, some teary moments just because obviously, if any woman who's watching has been in compression,
Mm-hmm.
very, very tight. And sometimes pulling that up and down over an area that's just been operated on can be a little painful. But, those are just blips in time, truly. Like I look back on that and I'm like, wow. Like I'm fascinated with my own persistence and resilience in that way. Because it's not easy to do, but it's doable. It is certainly doable. You just have to go into it with the right mindset of knowing that it's a journey and it's not just a stop along, while you're doing some other stuff.
I think that a lot of women are trying to figure out timing.
Mm-hmm.
And they ask me that, I have a lot of women in their 30s and 40s, 50s, and they say, I get it. I have lipedema. I get reduction surgery. What do you think about time? What I answer back is, lipedema is a hormonally induced acceleration of fat tissue.
Mm-hmm.
And if you're expecting a huge hormonal shift, like if you came to me and you were 30 and you're like, I want to go through 3 or 4 pregnancies, I'd be like, I don't know, maybe wait. But honestly, there's no good time. Do you have, timing? What would you say, Ben, now that you're on the other side?
I mean, I would say really listen to your intuition, listen to your doctor, listen to what insight they have to share, because I discovered lipedema in fall of 2024. I had my appointment with you to get diagnosed in December of 2024. I had my first 2 surgeries booked by March of the following year. Like I knew, I was like full speed ahead, let's go. That's a little easier for me to say just because I am not planning to have children. So that wasn't a part of my decision-making at all. But I see that being such a prominent topic with women who are around my age with lipedema, because it could go either way.
Mm-hmm.
You don't want to let the disease continue to progress, but then also, should you wait? Should it progress from the pregnancy? There's so much to consider. I would say my only regret in surgery is that I didn't know about it sooner.
Mm-hmm.
When I got diagnosed, I'm no longer a stage 1 lipedema patient. So I think back to, what would that have been like had I gotten diagnosed sooner and I could have pursued this sooner.
Yeah. And I think one of the things that is mentally hard to wrap your mind around, and this is something I talk with women about in consults, because they'll ask me, 1, timing a surgery, what should I do? Mm-hmm. And then 2, is this going to progress? What is that going to look like? And I always sort of hedge, because the more awareness that's here, the more research that's coming out, we're doing more and more almost every year. And women that, now are in their 70s and 80s that have had lipedema and are struggling with uncontrolled lipedema and have been for decades, they didn't have any treatment plans. And so, we see what it's like when you have nothing. But now, particularly if we're seeing great results with the GLP-1s in terms of anti-inflammatory properties, there's going to be more and more of those medications. The surgery techniques are getting better, compression's getting better. I just don't know if you're a woman who's like, I have lipedema, I would do reduction surgery today, but maybe I have these hormonal things that are coming down the pipeline. And I've seen it go bad in the past. And in my head, I'm like, yeah, but we don't know what it's going to be like now, right? Like if in between pregnancies, you're on a GLP-1 and we're really hitting the compression during pregnancy and all those other amazing things that like vibration plates and dry brushing and all those other safe things that we know we can do during pregnancy. I don't know if you had reduction surgery before that it would be something that completely exploded and that you would have been like, oh man, I wish I would have waited. And so again, as we've already said, again, this challenge for women with lipedema, again, is that we're flying a bit blind because we just haven't seen this play out for decades as we had for women who have had no treatment. Mm-hmm. So, we'll obviously be keeping to follow along with your journey and see if there's anything new that pops up. So many women that I see that are have lipedema, they have this whole argument of why they need surgery. And it's not about their legs looking nice, and it's only about function. And they go on and on. And I'm like, you deserve to be okay with wanting good looking legs. And, I know these surgeons are really trying their best, but I think it's unfair to tell a woman with lipedema, like, no, you just have to get what you get and like live with it. And what your pictures, which anyone can look at, our article that we're going to post sometime this week. Thank you so much for sharing. I mean, you look amazing. I mean, how do you balance some of this with this lipedema space?
Thank you. Yeah, I think, like you said, you're absolutely allowed to want your legs to not only feel good, but look good, especially to you, whatever that means to you. They don't have to look good for other people. They can just look good because you want to feel good in your skin, And when we think about lipedema, and I think about my own lipedema, some of the symptoms that I experienced with like pain or swelling, heaviness, like all of those came sort of down the line. The very first thing that I was dealing with my lipedema that I can trace all the way back to hitting puberty is that my legs always looked different than my peers. That is like the root of it to me. So I think when we say I just want my legs to feel good, it's like, yes, we're allowed to want that, but also honor that part of your journey and say like, yeah, and if they look great too, that's awesome. Like I would also really like that, because that is part of what lipedema sort of robs you of, is that feeling of feeling good in your own skin. And I had come to some acceptance of that along the way, because I just thought, I was athletic. I always thought it was just genes or muscle or whatever. I'm like, oh, you're just the girl with the big legs. It's fine. But knowing what I know now, I look back and I go, oh, wow, my body was just fighting its own battle too. And I just didn't know. So you're allowed to want both of those things. It's not selfish. And because lipedema is both a physical and a mental condition, it affects us in all ways in our whole body. You're allowed to have it treated in that way as well.
Yeah. I think that it's just so important to resonate again and again, because with these women with lipedema, have been told forever, that they're making this up, that they just aren't, doing the right things, and it keeps getting worse, and they just don't understand. And so just to keep opening up and empowering these avenues of saying, you deserve all these different things, treatment plans, to not be in pain, to have more function, to like the way that your legs look. And I'll tell you, when I talk to them about lipedema, a lot of them are quite reasonable. Like when they're talking about how they want their legs to look, right? They're not like, oh, I want it to be this one way and that's the only way. And, a lot of them are just like, look, I just want it to look a little bit better. And I get it. And I think that they deserve to be that way.
Yeah.
Well,
absolutely.
Sarah, thank you again for sharing your story, and for the second time. And we'll keep doing these updates, because it's just so impactful for women to hear these stories and to sort of kind of see how the journey plays out for one person. So thank you again.
Of course. Thank you again.